everyone, 12 o'clock, so we'll get started. So the PE department's happy to welcome Dr. Lukai to give our seminar this week. Dr. Lukai is from the Department of Pediatrics, Radiology, and Oncology, and Pharmacology and Toxicology here at UofL. I became acquainted with Dr. Kai through our interest in radiation. Particularly, we had an interest in how radiation will affect the cardiovascular system in the context of space travel. I don't know if you guys were interested in the launch yesterday, but you saw the cool picture of the Starman in the car. That looks really cool, but it's probably not a really good idea to do that if you're getting a chance because you're going to be bombarded constantly with radiation. And particularly in space, it's a low-dose radiation. So you kind of, we all know that high-dose radiation can cause some pretty serious complications for your body, particularly in terms of cancer or worsening heart disease. But at the low doses, there's a lot more ambiguity about it. Dr. Lukai's expertise is looking at low-dose radiation in the context of diabetic or diabetes. So I think that's what he's going to talk to us about today. All right, so again, welcome Dr. Lukai.
Yeah, good afternoon, and thank you very much for coming. And today is a great pleasure for me and to come here. And like Kevin said, and I really appreciate Kevin and Patricia invite me and come here. And this is my first time to have a talk in this campus. I come from the department of school medicine and work on pediatric. And but I have an associate appointment with the radiation oncology department. And so today I would like to share some a part of my work and regarding the radiation. And the other two, we are in the same page, and I want to have some background introduction and about what is ionizing radiation, the dose, how to describe the radiation dose, and how about the acute radiation and the high and the low, what is the difference. And like Kevin just mentioned, everybody knows high dose radiation is scarable and very dangerous, and so far away from there, but the low dose radiation is different. We need to keep in mind, and so we have to balance. And in the following part, I will talk about what is the hormesis, what is the adaptive response, and or bystander induced by low-dose radiation. And in the second major part, I will talk about what is the potential and application for the low-dose radiations. Okay, so I think the easy way and use this table and like a graph easier to understand is ionizing radiation. So that is like a whole like a spectrum of electromagnetic and spectrum, and you can see that is a different energy and it's increased, and that is a visible light and the UV, and so that's dark ionizing radiation, X-rays, gamma rays, and also high energy radiations. And how like radiation and work with our body for the molecules in our body. So this is not ionizing radiation. When you have the wave goes through your body, it goes through the molecules. That is a heat and the molecule, and make the electron from the inner level to go to a little high and go to that, make the cells have some heat and release. But that is molecule still stable and not dangerous. But the ionizing radiation is different. When they go through the molecules, and they take and one and electron and off from the molecules, so make the molecules is not stable, and that molecule and kind of the scrap or steal and the electron from other molecules. So that causes the neighbor molecule and the damage. So that is the one big difference compared to the ionizing radiation and the non-ionizing radiations. So for the cells, and we know that DNA is the core, is very key, and the molecule in our body control all the cell phenotype and the functions. But the ionizing radiation, when they have an interaction with the DNA and make the bond break and cause the molecule change, so that causes the DNA damage. So the ionizing radiation is the primary target in our body, the DNA. So the DNA is the very important the molecules in the cells and damage. And if you damage the one protein, that is okay, the cells still can survive, but just lose a little function. But if you damage the DNA, so that is the cells is will die or have different functions. So talk about the radiation, and we need to know what kind of radiation we have. And usually we talk about the LET. So that is linear energy transfer. So that is based on that the linear energy transfer, and that is have a low LET radiation and a high LET radiation. So X-rays and gamma rays belong to low LET radiation because that for that radiation they have like a small amount or small energy deposit goes through the molecules with the unit of the space. But if high LET radiation, that you can see even a certain amount, the distance, they have a more energy deposit to go through the nucleus and go to the cells. So that is divide the low LET radiation and the high LET radiation. And for the radiation dose, it's not like the medicine we take 1 gram, 10 milligram or something. That is the difference. And when the radiation in the air, and that is have the different code, they call the routine. And but they go to the body, biological body, and that code is like a soft dose. So they use a green or a red. And if that talk about the effect, that because you need to consider different organ, large organ, small organ, or the different kind of organ. For example, in our body, for marrow system and the thymus and the spleen and the testes, that is super sensitive to radiation. But if the liver and like a heart and the kidney is not that sensitive, so that is talk about the like equivalent dose and the effective dose. They use seaweed and also use ring. So that is when they talk about the evaluation different things, and they have a different unit to use. And how the damage radiation and like impact our body? What is the outcome? I think this is a graph give you a clearly explanation, and that is here is from even from the second 2 years and even for the generation. So that means from very quick and very long time. What happened? The ionizing radiation, and if that only causes excitation, so that is no problem, just release a little heat. But if that damage form the free radical, that is ionizing radiation. So that is where, and have 2 ways. If your body has a lot of the free radical scavengers, and they can scavenger and remove the free radical, okay, you are not got damage. But if they are not that much and a free radical scavenger, and that will cause DNA damage. Okay, in the DNA damage in our body, we have the very beauty the functions, and you have the daily life. You have like UV and a lot of stress cause DNA damage. But our body has the DNA repair system that can efficiently repair like spontaneous DNA damage. So that will play some role to see what is the dose, how much, how many DNA damage. If the certain amount our body can handle, can repair, and no mutation, no dysfunction, and the DNA damage is okay, and then pass, and no problem. But if they have some damage, and not fully correctly repair, and they probably form some gene mutations or DNA mutations. If that mutation, the cells, happen in the germ cells, that will be a problem. If that the germ cells cannot be eliminated by apoptosis and eliminate function, and that will cause some genetic effects or hereditary effects, cause the bad for generation, next generation. But that if happen in the somatic cells, probably you know the somatic cells that is not related to reproductive functions, that liver or intestinal or brain, and that is depends. If that body still have a strong and limitation in the function, through the apoptosis and eliminated the cells with abnormal genomic information. So that cell just died. But if the environment is not that perfect and not that efficient to remove the bad cells, and that will probably got some preliminary, like a malignant differentiation, and in the long time, and 20 or 30 years later, become cancer. So that is the DNA damage not repair and go to the two directions. And sometimes the DNA damage is too much and cannot repair, the cells cannot survive, die. But the died cells also have the different results. If happen in the embryo, so that is a problem because your organ formation and your development got the abnormal. So that will have the malformation and the teratology effect. But if that happens in the somatic cells, and that's okay, and depending on the organ and depending on how severe. If mice of the cells, like huge cells, immediately die, okay, so you are some organ like intestinal or you have like a blood forming cell system or vascular system collapse, and you are died. They call it acute and early radiation syndrome. But if they only have a few cells die, and that organ is okay and still function, but in the long term, probably they have latent effects. So that is how radiation and the exposure cause the damage. What is the outcome? Depend on the situation, depend on the repair and the mechanism in our bodies. And today I will follow this part and cell death and how the severe, how like minor, and what is the low dose effect. So, like Kevin said, I'm not want to tell you radiation is not that bad. It's okay, have a hormesis, and you go home to you want to expose radiation. That will be very criminal. So I first let you know radiation is very skillful, dangerous, and like this. And they will cause, depending on the dose, will cause acute and the syndrome. And that is called the clinical symptoms. And that is dependent on the organs. That from the hematopoietic system and go to the intestinal gastrology system and then vascular system and the neural system. That depends on the dose. So the small dose probably causes light, but the severe dose causes very severe syndromes. So everything is depend on the dose. So this is the dose from low, very low, and no clinical symptom. But later you can see they have a more increased dose, and they have some hematopoietic system. You have lose the white blood cells and lose the lymphocytes, and later cause the intestinal system and no virus and bacteria go to your body, cause infection, sepsis, and you have a symptom. And if the dose still increase, that vascular system collapse and you don't have normal blood pressure, you cause bleeding everywhere. And if the dose still high, immediately lose the neural system control. So that is very, very dangerous. Not joking. So that is give you the dose concept. So they told us that if you are exposed to 20 to 30 degrees, and you are already damaging your vascular system, central neural system, that is will die within 2 days or 3 days. And if the dose lower than 20, but larger than 6 degrees, that causes GI, that is gastrointestinal symptoms. And if still lower but higher than 2 degrees, that causes your blood forming system, infection, sepsis, and that is the problems. But I'm not after that. The scare you and you remember that is very dangerous. And then I want to go to the lower dose. And you can see still have some minor detectable damage or change. But what I talk about is lower than 0.1 degree. So that is 100 milligrams. And what the 100 milligrams means, when you go to the hospital, you want to do a CT scan, whole body CT scan. That is dependent on the machine, but roughly from the 25 to 75 milligrams. So that the dose I talk about, that's something clinical or like the medical used dose level. And I still want to emphasize that also related to LET. And for low LET radiation, that is smaller than 100 milligram. But if high LET radiation, much smaller, and 50 milligram. And if we also talk about the dose rate, and that always affect the effect of radiation. Where we can get the low dose radiation, and that depends on where you live, and what kind of house you are staying. And you fly very often from New York to San Francisco, you probably got 5 milligram exposure or 1, something like that. And also, we have a lot of the man-made resource, medical application and occupational and radioisotope, and so that is the resource for the low dose radiation come from. And for example, where like you live, probably you're going to believe that why I talk about where you live. For example, and in United States, and the average and is very low, and we call it the normal like a nature background. But you can see in Colorado, they have a lot of the mountain and the rocky that release more the radiations. So you can see that is the highest nature background areas. So that is yearly got the 75 to 100 voltages and the range per year. And other places, and here I also have a little high, and in south part a little high other than that, that is lower. So that is depends on where you live. But I'm not sure that that area causes a bad effect. Probably it's good. I know the Kentucky, no radiation, but it's obese, cardiovascular disease, cancer, and everything is high. But Colorado and obese lower, cancer rate lower, but it depends a lot of the information factor. Okay, so now I will talk about why I'm interested in low dose radiation. And before, and so even right now we use called the linear non-threshold curve. So what that means, and before we know, like from all the radiation effect is based on Japanese atomic bomb survival, and that is a high dose. And we know, okay, radiation can induce DNA damage, cause cell death, mortality, and also have some significant inhibition for something related to function. For example, DNA repair activity and the immunofunctions and the cell proliferation. So they have increased in fact, also have decreased in fact. But that also, in fact, we learn, and that is based on high dose. And for the small dose, because we do not have that sensitive method to detect, okay, 1 gram and 1 milligram is induced DNA damage or not. So we don't know, but that means not in fact. So what like a radiation protection agency, they decide just extrapolate, calculate, and to 0. So form the linear non-threshold models. So that is the like a traditional idea. But right now they have a lot of criticize for this. I will explain to you. So this is the experiment by this group that is happened something around 60 years ago, more than 60. And they gave the animal low dose radiation treatment. So this is the right bar, and they look for animal survival rate. And the original thing probably the radiation caused the life shock, but unexpectedly we found the life become longer, and especially for male. So that they called the this is like some kind of stimulation. So that is the first for radiation study. But that's called the hormesis. But actually, if we look back for the other field, chemical, and actually the hormesis already known for a long time ago, before the radiation and story. What did they found that? And one group, they are using some of the phenolic compounds. They try to use to protect the tree against the fungi infection. So they spray the tree and against the fungi infection, and they found that is okay, can kill the fungi. And they want to save the money, of course. They dilute the compounds, the chemicals. and dilute until they found too much dilute, not to kill the fungi and stimulate the fungi growing. So that is they called all. Sometimes the chemical also becomes hormone, stimulated the fungi growing. So they gave the hormesis kind of like a derived from the hormone like a response. So that is the original idea, so hormesis. So come back from the radiation, and after that, a lot of people start to work on this field, and they found the low dose radiation can stimulate cells growing. So for example, this is the study. This is the radiation dose that is increased, and this is the cell number, so that is to see the cells growing. But if the radiation increased, the cell number totally dose-dependent decreased. So that we know and kill the cells. But unexpected, in the certain low dose range, the cell number is not reduced higher than the 0 without treatment. So stimulate the cells in the certain low dose range, but later kill the cells. And this is like a DNA repair. And they also found the low dose radiation can increase the DNA repair capacity. And I was lucky, and when I do my PhD project, and I work on the DNA damage and DNA repair with my mentor, and we published in 1990s. So that is related to low dose radiation and stimulate the DNA repair capacity. So what we found, if we just focus on the high dose, you can see from 0.5 and 1, 2, 4 degree. And we found the DNA repair capacity significantly decreased. And, but if we go to further lower the kind of the chemical, and also found the stimulant effect, and then plateau and later going down. So that is the DNA repair capacity. And even right now, they still have a lot of people working on this field. So they use the, like a transcriptome profile review to see, okay, like before we only focus on one gene, one protein, and one protein to see what's going on. But actually they look for all the like response. They divide cell death, cell cycle, and other like immune response, and also DNA repair. So this is the three group from the human. They live like a different background, from very low and like a little bit high, and further high, and much high, and they see, and they have dose-dependent increase, and the different kind of the response for the tissues. So that means low dose radiation have a multiple function, not just the stimulate one protein, one gene, and they cause some cell death, but they also have the repair and defense function turn on. So you have to balance what is the final outcome. And low dose radiation also stimulates the antioxidant functions. So that is at least a couple of the publication. And even right now, they found okay, low dose radiation stimulated NERV2. So NERV2 is a nuclear transcription factor that can turn multiple antioxidant. That's why if you do SOD, catalyst, O1, you can see one by one to increase. But the principle of the reason it becomes NERV2 was upregulated. So this is the one example. They look for the downstream gene of NERV2, the whole one, and you can see this is a low dose radiation that is a 50 milligrams, and they found 6 hours increased, and 12 hours significant increase, and later a little decrease. And they found the NERV2, and the total NERV2 not increased, but the NERV2, like I mentioned, that is a nuclear factor. They don't need the total amount increase. They need the same amount but go to nucleus, plays a function. The location is more important. So this is a NERV2. So now we understand that is not linear, non-threshold, and the curve. And actually they have the U shape, that is this one, and called the J shape, like this one. So that is the real and the work. The low dose radiation is have the stimulation functions. And what is the like a whole population? And this is like I mentioned, like in the world, they have a lot of areas that have high background radiation. So this is in China, and they like a survey like more than 1 million people, and they found their cancer risk not increased in that area, and even a little bit reduced, but not significantly reduced. And this is in the United States. They're looking for lung cancer. And this is 2014. They also found the hormesis phenomenon. What is the conclusion they said? And our analysis added the body evidence suggests the linear non-threshold model and is kind of not correct. And low-level radiation probably can have the protection against the cancer. But even debate, but at least they have the human state support not linear non-threshold. And because we are like the human being and the biology, and they have the evaluation, and they are not like low, a little high stimulate. And actually the certain amount of radiation is required for your normal life, for your normal biological function. You can see this is 3 situations. Control level, and they make the hole in the earth and place the hole like a lead, very thick lead, and the hole put the cells there. That means to protect all around nature radiations, no radiations. And this is have a small amount those radiations, but you can see growing normal and no radiation, no background radiation, the growing slow. And if have low dose radiation, that stimulate. So that certain amount of radiation is required for our biology functions. So that only talk about the low dose radiation and stimulate or not stimulate, these people and the professor and Dr. Wall and very smart. He want to look for not just low dose radiation. They want to see what the benefit. And if low dose radiation have a stimulating effect, probably can do something for the second large dose radiation. So what he did, he collected human lymphocytes incubated in the vitro and gave the 1.5 degree radiation, that's large dose. And they look for the chromosome aberration, and another group, before the large dose radiation, gave the small amount of low dose radiation treatment. And you can see the chromosome aberration not first increased by low dose radiation plus high dose radiation, but instead it was reduced. So that called adapt response. Means that the low dose radiation makes the cells adapt to the radiation, become resistant to the next one. And following his study in the in vitro, and I work on the in vivo and look for the bone marrow and tested germ cells and look for the chromosome aberration. You can see the control were low or even 0, but give the low dose radiation treatment, they have certain amount of chromosome aberration, but the high dose significantly increased. And we give the low dose radiation plus high dose, and if from theory, and we have an estimated amount that should be lower plus the high and equal like this. But what we found is actually is significantly reduced. The high dose radiation induced the damage. So that response not happened in the in vitro, also happened in vivo. So okay, so we conclude the low dose radiation makes the cells and a lot of the protect function increased, makes the cells adapt to respond to the next high dose radiation induced all damage, gene mutation or cancer or cell death. And actually later we found that even we use a lower dose chemical also can induce same response and even to the high dose radiation. So that goes cross and adaptive response. So that is a hormesis and adaptive response. And the low dose radiation also has one called the bystander effect. So what is the bystander effect? That is when you irradiate A cells and the B cells not irradiate, the A cells still show some effect for the B cells. So the simple model and irradiate the A and affect B, but they also use the dish and give the low dose radiation treatment, and then use the medium transfer to another dish without radiation, and that cells also called effect. So that is called the bystander effect. And they published in the Science in 2003. And what these pink cells is a single radiation exposure. The blue cells and the not radiation exposure. But you can see still have some damage for the nucleus. So that means the irradiated cells can affect the neighbor cells. And they use another model. This is the dish, and they give you the aluminum and can protect the alpha particle irradiation. So this side decided that one area irradiated, and the rest part not irradiated. They divide area 1, area 2, area 3, depending on the distance from the irradiated cells. What they found? This is the irradiated area. They look for the DNA double-strand break, and you can see the dose-dependent increase. But the not irradiated area, they also show the DNA damage, but they not show the dose-dependent effects. And no matter area 1, area 2, area 3, basically they have same effect. And this is the other measurement, same thing. So what they found that is the cells like release something like also like some gut junction and cytokine can affect the neighbor cells. Like the review they summarize, probably they have some extracellular vesicle and or like exosome and that play some carry the protective agents. So far, and a lot of agencies are interested in the low-dose radiation impact. So even for the Department of Energy, they have the program, and that is 10 years ago. And right now, they don't have the budget, they closed. But recently, they got money, they plan to have reopen the low-dose radiation program for the DOE. So probably they can think about some grant from there. And this is one group, they are really interested in the radiation hormesis. They discussed the phenomena, and they discussed the new ideas. And Japan, because they have the atom bomb survivor, they're also interested in low-dose radiation field. And this is a scientist from Canada, and that comes the Atomic Energy Canada, the company, and they're also interested in the low-dose radiation field. So that is some background and what is the low-dose radiation, and that compare the high-dose radiation is different in fact. And they have a hormesis, they have adaptive response, they have a bystander effects. So now I want to move to the next part. That is it possible to apply the low-dose radiation in the clinical setting? And in 1999, I was invited to have a review to like overview what is that moment in the status of low-dose radiation research. So of course I have listed several items and like a subtitle. But one is can the reduction like low-dose radiation-induced phenomena can be used in clinical? So that is the one question I have. So after that, I'm interested for that field. So I think the stem cells mobilization is very important. So I'm thinking the low-dose radiation can growing cells is probably possible to stimulate the bone marrow stem cells go to release to peripheral circulation to have some repair. That is like in 2004, so a long time ago. So what we did, we gave the animal and the low-dose radiation treatment. We decided to look for the bone marrow inside and look for the circulation and at a different time. What we found at 9 hours, very quickly, low-dose radiation turned on some of the stem cells growth factors and in the peripheral tissues. And in the bone marrow system, the receptor for the growth factor and upregulation. And at 48 hours, we found the more stem cells in the bone marrow system, and that means stimulated the bone marrow stem cells double or like proliferate. And in the 72 hours, and that is an increased number also go to the blood circulations. So that is really have the loop from the peripheral tissue, release some cytokine, then go to the bone marrow system, stimulate the stem cells, and then release to the blood or circulation. So that is excellent. But the next question is that low-dose radiation mobilized or stimulates that cells is function normal. So we decide we use like a two group. One group give the low-dose radiation treatment or give the like a growth factor treatment as a positive control. That makes the irradiated mice have the more nuclear cells from bone marrow to the blood circulation. And then we give another female, like indicate like a gender difference. We give the same, and we give the lesser dose radiation treatment. Eliminate all the endogenous blood forming cells. And then we give a transplant for the blood cells and include the mobilized circulation nuclear cells go to the donor and the recipient. And we found, and that's the like a lesser dose treatment. If we give the normal and mice circulation blood cells, that actually have a very little small amount of stem cells, not that much. So you can see they can survive, but as long increased, the time increased, and so you can see that 14 days that is already no white blood cells, and the survival rate only reach about 10%. But if we have low-dose radiation treatment, the donor have low-dose radiation treatment, the stem cells growth factor treatment, or combined, you can see that significant recovery of the blood cells and white cells. And the survival rate from low-dose radiation have 75%, and if we have like plus 100% growing. And this is the spleen. That gives you an idea. That lesser dose killed all the peripheral and immune cells and B cells. So, and the spleen very small shrink, not cells colony there. But if we have the transplanted the good and blood cells, you can see that form new colony in the spleen. So that means the reconstruction and reforming. So that means that it really functions, not just a number. So that is very exciting. Can we directly use the clinical? That is good news, but the answer is no. Because the low-dose radiation stimulate Hormetic system, stimulate the normal cells, probably also stimulate the tumor cells. And normally, our body probably have a single or very small number of tumor cells, but our immune function can kill and can inhibit growing. But if with low-dose radiation treatment stimulate the tumor cells growing, that will be a big trouble. So we want to see, is there any difference? And also like the low-dose radiation can make the normal cells against the radiation, large-dose radiation, probably also make the tumor cells against the high-dose radiation. So that is a reduce the surge and the impact. So that is not good. So we want to see if the in vitro, they have some time window or dose difference between the normal cells and the tumor cells. If they have the different response, we will pick up the condition favor to normal tissue, not favor tumors. That will be clinical relevance. So we use the whole bunch of tumor cells, the solid tumors, and this come from the lung, come from the liver, and we also have the premium cells, and this become some normal cells that also lung, and that is the liver. And what we see is, first in vitro, we look for the cells growing curve. So this is the normal lung and the cancer in the lung, and this is the normal liver cells, and this is the liver tumor cells. And here is give you an example. The blue, that is without any low-dose radiation treatment. That cells growing normally linear, and this time, and this is the number. But we give the positive control, indicated the cells is a sensitive to radiation, or cells growing is really shown the number, and there's 1 degree. You can see, if you the growing, you give the 1 degree to kill a lot of cells. So the total cells number decreased. So that means the system is okay. But if you give the low-dose radiation, 25 to 100, you see all the have shown the stimulation effect have more number compared to control. And the same pattern, control, large dose, small dose, stimulation. But it come to the liver, cancer, you can see the control, the blue in here, the large dose still kill. The control in here, the large dose can kill, but not stimulation for the low-dose radiation. So that means the low-dose radiation really shows the stimulation in the normal cells, not in the tumor cells. But that is only in vitro, that comes in vivo. So in vivo is more important. So we want to go to the in vivo, but in vivo is more complicated. We already mentioned that low-dose radiation can stimulate immune functions and protect functions, and especially they have anti-tumor immune functions. So we use the nude mice. The nude mice, they don't have cell immune functions, and that loses the T cells. And we give the human tumors, and then we look for the treatment, low dose radiation, and compare the normal control, not radiation. So you can see that like after implant, the tumor growing, and you have a low dose radiation treatment, not stimulate the tumor further growing, actually same or even less. And that is like in vivo. They have two kinds of tumors. So okay, now we can make the conclusion. Low dose radiation stimulate the normal tissues growing, have a homeostasis, but not happen in the tumor cells, in vitro and in vivo. That is very important. And we also want to see if the low dose radiation can make the adaptive response to the therapeutic. Because you have tumor, you cannot just use low dose radiation therapy. That is too small. We still want to have like a therapeutic dose to kill the tumors. Is that low dose radiation can make the tumor cells resistant to the high dose radiation treatment? So we want to know that. So this is like a model. We give the cells growing again, control, low dose radiation dose, and high dose radiation therapeutic dose, and low dose plus therapeutic dose. And from the normal cells you can see, and this is the control, and low dose radiation a little bit increased, high dose like kill some cells, and the low dose radiation plus high dose, and you can see normal cells they can reduce the therapeutic dose to kill the cells because that is have less. You see, D2 alone have less cell number. That is to protect, show some protection. But that did not happen in the tumor cells. You can see low dose control and the tumor growing, and the low dose radiation not stimulate the tumor growing, but the therapeutic dose kill the tumor cells number. So that reduces the total number. But the therapeutic dose plus with pre-exposure to low dose radiation, that will change that. Not like a protection, the killing effect, and even enhance, sensitize the tumor to be killed. So that is still in vitro. We also want to see in vivo. So the in vivo, we give the tumors for the mice, and we give the therapeutic dose treatment, and the one group gave the treatment, before the treatment, gave a low dose radiation to see what is the difference between them. So we use the tumor inhibition and measurement. So that means the higher is the better to inhibit the tumor growth. You can see control that tumor growing, not any tumor inhibition. Low dose radiation have a little bit inhibit the tumor growth. The high dose, therapeutic dose, of course, will inhibit the tumor growth. And if the high dose with the pre-exposure for low dose radiation, you can see they also not affect, decrease the tumor inhibition, and even good, further inhibit the tumor growing. So the two tumor cells, they show a little bit different pattern, but generally they now and like a adaptive response to the tumor cells. And this is nude mice. And we go to C57 and with the normal immunofunction mouse model, we use the mouse tumor and to see the same thing or not, and it's happening the same, not just in the nude mice. Okay, and we published that in the 2008, and that means low dose radiation not induced adaptive response to tumor cells in vitro and in vivo. And not just from our group, my group. That is from other groups also shown the same thing and shown to have different response in normal and tumor cells to low dose radiation. And we first want to look for mechanism, what's going on between the tumor cells and the normal cells. And we found in the normal cells, small amount of radiation to generate some small RS that turn on the ATM, and that make AKT and GSK and cell signaling and the cell cycle turn on and stimulate the cell growing. And that also make the nerve 2 from the cytosol to the nuclear turn on multiple antioxidant enzymes. So that is turn back the antioxidant to protect the cells in case exposure large dose radiation. So that is this side makes the adaptive response, this side stimulate the cells growing. So that is the mechanism. And last year they have a review. They look for the low dose radiation and exposure. Actually they have a multiple function, multiple level effect. And we know the tumors, and they have the gene mutation, they have the oncogene turn on, so genomic difference. So that is a epigenetic change also different. So that is probably the mechanism why normal tissue have the different response with the tumor tissues. So I mentioned and our bodies have a low dose radiation can stimulate anti-tumor and immune functions. And here I want to explain to you. Like here is a nude mice. They don't have the NK cells and the cells to kill the tumors because that is a kind of the deficiency mouse model. But here you can see that is the normal. They have the immune function there. And in the nude mice and the low dose radiation, maximum can enhance the 17 and from 10. But you can see if they have the immune function there, they have a 30, big difference from the here. So what means? That means the low dose radiation sensitize the tumor cells to the large dose radiation. They have one part there. And the low dose radiation also stimulates immune anti-cancer functions to kill the tumors. So they have synergy effect. So that's why I have the more effect compared to the nude mice. So is the low dose radiation really can induce the immune functions, and actually it's true, and there are several publications have indicated that. And this several publications and this here. And this is the one like a very important study. And they make the mice and the immune function were shut down, and they give the chemical. And before that, they give some like a different treatment, give a low dose radiation. So you can see that all the animals there have immune deficiency, suppression. And this if they don't have any low dose radiation treatment, that was like a survival very low. But if they have low dose radiation treatment, that survival longer. So this is how last? Oh, okay, that's fine. Yeah. That's all 1 hour. Yeah. And so this is like another study. They look for the animals and have the bacteria to induce the sepsis. And you can see, and they have different conditions. They make sure that when those infections cause the animal die, and later they pick up the dose here. But if they have low dose radiation treatment, that survives significantly. So that means make the animal to resistant to the infection, sepsis cause the inflammation. So that is a different condition. So now we really make the conclusion: the low dose radiation not affect the tumors against the radiation or chemical therapy. In fact, actually that make the whole body's immune function to have the tumor therapy, and they also protect the normal tissues from the therapy caused the side effect. And if your normal tissue can tolerate, we can increase the radiation therapeutic dose, kill the more tumor cells. So that is low dose radiation really high for the therapy. So we have like a summary, and we published 2 years ago in the International Journal of Cancer, and we talk about radiation from the new field. And in the following year, the art group also have a good summary for this field. Right now it's very hot, and immunotherapy for cancer, vaccine, and STAR are very hot now. But the low dose radiation can replace the vaccine and immunotherapy. And for that, I got an award in 2008, and achievement award from the International Commission Society. Of course, I'm very happy, right? Yeah. But after happy, I still think, okay, the low dose radiation against the tumor therapy is just one thing. That is a long way to go, and we need to grow it slowly. But can we use it in the diabetes field? What is the rationale? Because we know diabetes is related to RS, diabetes is related to the immune functions, and diabetes causes like stem cells bite and cause the organ damage, obstetric damage. So, and we have the review data proposed with the Japanese group, and then in Japan they are first study for the NOD. NOD is a spontaneous type 1 animal models. And this usually the NOD at age 16, they start to show the diabetes. And so they count which group have first animal shown the diabetes in the different group. So this is control, and this other group, and they have one single dose low dose radiation treatment before that. And you can see if you have one dose treatment, and in the 13 weeks old, and then significantly postpone the first animal become diabetes. And if we cut 24 weeks, and in the control, they have a 60% become diabetes. That you see, if other groups have one single low-dose radiation treatment, significantly prevent the diabetes, and in the spontaneous models. So that is like a low-dose radiation prevent diabetes. That I think that is not practical. And for example, okay, you guys tomorrow go to the have low-dose radiation treatment because it can prevent your diabetes. No way. And but I will go to a different angle. Once the diabetic patient, they know they have diabetes. They know someday there are complications. The earlier the better to prevent the complication happen. So we think about the low-dose radiation to prevent the complications. So we work on the heart, kidney, and the skin. So what we did, we use STZ-induced diabetes models. And then we gave the 25 milligram X-ray exposure, and we look for the kidney function, the protein urine, and this diabetes and significantly increased. And the diabetes with low-dose radiation treatment significantly prevent, and all the other measurement. And we also work on heart and same pattern and got the protection. And we also work on the reproductive system, the testes, and the same thing with the significant protection. And this is some group work on the neural system. And they look for the diabetes. You can see diabetes significant increase the brain and cell death, and the significant increase the cell death number and the reduce cell proliferation. But if they have a low-dose radiation treatment, that and growing cells keep increasing, the cell death and not increased. So that is to protect the neural system too. And that is still prevention, but I'm also thinking about how surgery. So we let the diabetic become diabetes, and then 2 months without treatment. And then we can make the artificial ulcer cut down. And then we look for the healing. This is control. At 15 days, the healing were well. But diabetes, not healed. And leave the ulcer very difficult to treat. But we have the low-dose radiation treatment. You can see significantly enhance the healing with speed. And this is something related to mechanism. And in other group in the Harvard, and then they found that the low-dose radiation actually is stimulates the glucose utilization. And then that is related to the adaptive response. So this is the conclusion. The low-dose radiation have multiple functions, prevent diabetes and prevent the complications. So that is like for my study. But I have one part. The low-dose radiation also have some impact for the other chronic disease. So you can see that it can stimulate the bone and structure healing, and can have new muscular formation, and that CT scan can enhance the longevity and make our long life. And this is other part, and they also reduce the atherosclerosis and that vascular and phenomena, and even ApoE model, and that depends on the phenotype P53 involved. And but I published the first paper in 2009, and the India group, they are very exciting. They said if the low-dose radiation can become the therapeutic approach, why we are against that? Any drug have the toxicity and that potentials. And so now they start clinical observation of the humans. So this is entrepreneurial and people, and they found that their blood have adaptive response phenomenon. And the more interesting, and in Canada, they directly think about the low-dose radiation treat the Alzheimer's disease. And what's going on in the Canada, Ontario area? One senior lady and become Alzheimer's disease, and they try all the methods done time. And her husband finally looked for the physician, and he said, "Hey, listen, and he knows low-dose radiation can do something, and it's possible to try to low-dose radiation for the non-invasive treatment for his wife. Sorry." And this started for in 2015, and they have sometime and have one CT scan, and this is the final results, and they look like normal right now. And she has the feeling want to eat pizza, and when people call her, and she has a normal response after the low-dose radiation treatment. And because her husband is a Parkinson's disease, kind of like this. And after he found his wife and very well recovered, and that don't need medicine, don't need like a lot of medicine in your body, and he started low-dose radiation treatment for himself. And probably 2 years, 3 years later, we have some results. And for me, and I always want to look for mechanism. For the Alzheimer's disease, I think it makes sense because Alzheimer's disease also related to oxidative stress. And you can see that they call the amyloid beta peptide that is binding metals, they release a lot of free radical, cause the neural system damage. And if you have low-dose radiation treatment, turn on the multiple antioxidant or block the RS-induced neural damage. So that is the rationale. And for that, and last year, I got another achievement award again, and that for the diabetes research. So I'm of course happy again. But and like this is the today's now low-dose radiation very, very bad. Low-dose radiation sometimes not that bad. But like the message take home, you don't like severe radiation in a certain situation. And of course, that is have a balance. For you're happy, you got an award, you have to work hard. So that's some life of balance. For the radiation, the same thing. And the low-dose radiation, probably they have like some potential risk. But right now we don't know, debate, because they don't have the positive data. But not positive, that means negative. So we have to have the method to develop sensitive enough to confirm the effects. But that takes time. But the radiation have benefit a lot, of course. And what we can think, we can probably think about the approach as a senior people population. And if they have cancer, they need 20, 30 years, and like a span. And for a lot of the diabetic patients in the later stage, liver dysfunction and other organ like a dysfunction, you cannot take whole bunch of medicine go to your body because they cannot metabolize them. And the kidney also is limited with the junk. For the low-dose radiation, that's non-invasive, can stimulate the kidney function, and for 2 years, 3 years, and haven't got a chance to develop cancer, but at least can improve the life qualities. So we have like a commentary and last year, and the kind of the being young, and you have to balance, and like same thing, and that's low-dose radiation. And this is the paper come out last year, but I like this one. This is the kind of to give you an idea which one you pick up. So this is the table I want to show you, and this is the color is they have did a lot of the CT scan for so many patients. They have different age, and this is the number of the cancer induced by calculation, not a real found. It's calculation based on the linear and non-stressor model. And you can see that is very low, and that is like a 10,000 probably have a 2-1 and have the induced cancer. But you can see the lung cancer by the CT scan, and 31 you have one cancer diagnosis. You can rescue treatment. And in the total 5,000 people, so patients, they have a CT scan, and they detect more than 250 and almost 260 lung cancer patients. That got treatment, got rescue. And from the calculation, among the 5,200, probably have this is the rate, and probably have 1.5 people can be induced cancer. So compare that, which one's right? So not against the CT scan. So last year I did 2, so this year I plan to have another one. So this is my group, and you want to be happy, you have to work hard. And this is a lot of the trainee from China and work in my group. That is a CRI. And my R1 grant is low-dose radiation is prevent diabetic complication. And the JDR grant is low-dose radiation stimulate skin ulcer. And so the ADA grant is part of my diabetes research. So thank you very much. Sorry about that, and they have class.